Mesothelioma is an extremely rare disease, and typically we see it in people who've had asbestos exposure, but occasionally we see it in people who don't recall any history of asbestos exposure. It does happen sometimes where either the person didn't know they had asbestos exposure, or maybe they really didn't and they developed it anyway. But typically it's in people who many years ago had a history of asbestos exposure. And it can be difficult to diagnose because patients will sometimes have shortness of breath or pulmonary symptoms, and they're found typically to have pleural effusions. Sometimes draining the pleural effusions doesn't show any evidence of cancer, and I've seen patients who have gone on for many months or even longer before a diagnosis has been made. Sometimes often it requires a biopsy of the pleura itself. It often presents in a more advanced stage. Rarely can it be considered a surgical disease, but that requires very careful evaluation, ideally by a surgeon who's very experienced at seeing patients with mesothelioma. Because it's so rare, it really is best handled by, I think, surgeons who see many of these patients at experienced centers.